Hi, everyone. My name is Gigi LeKites. I'm from PKS Investment Advisors, and I have with me Alyssa Sinagra from Avery Hall. Today, we are going to be talking about the Inflation Reduction Act and Medicare. Alyssa is going to bring her many years' experience to elaborate on the changes that might be coming your way as a Medicare participant and what that means for you. A few housekeeping items. If you have any questions, please use the chat box down at the bottom of your screen. And then I guess at the end, Alyssa, does it work for you to do questions at the end?
Yes.
And I'll just, we can answer those at the end. I'll read them off to you then.
Yes, absolutely.
Just real quick, who PKS Investment Advisors are. PKS is an independent registered investment advisory firm affiliated with PKS and Company, the tax accounting firm. We were established in '99. And with that, we do all things financial under one roof. We do the financial planning, retirement planning, working closely with our colleagues on the accounting side to bring together the tax planning with your financial plan. We have offices in West Ocean City, Lewis, Delaware, and Salisbury, Maryland. As I said, Alyssa is from Avery Hall. I'll let her tell you a little bit about herself.
Yes, great. Hi, everyone. My name is Alyssa Sinagra. I've been with Avery Hall for, I think it's 18 or 19 years, since 2006. I started in the employee benefits market and then started working in the individual market, which is for people who are under 65 or people who are over 65 who don't have options for employee benefit health insurance. So I help with that and Medicare. I have, with a lot of help from my employees and associates, we have grown the agency to be servicing over 10,000 policies. So we're really busy, but we are always working to be more efficient for our clients so that we can handle what we have. We're licensed in many states, Maryland, Delaware, Virginia, Pennsylvania, Ohio, Indiana, Texas, Florida, North Carolina, South Carolina, and West Virginia. Avery Hall has been around since 1925, very similar to PKS, as they do all things financial services and tax planning. We do all things insurance. And so any type of insurance that you can think of is what we try to handle. We have over 100 employees that serve in 5 different locations all across the Eastern Shore. Seaford, Delaware, Milton, Delaware, Selbyville, Delaware, Salisbury, Maryland, and Easton, Maryland. I handle, or my department handles like the employee benefits and then the individual health insurance. So we call ourselves the benefits department. So we handle all of that in dental, vision, life, long-term care. But we also have an entire staff of people who are handling commercial and personal insurance. So like I said earlier, we try to handle all things insurance. So today I am going to talk about the Inflation Reduction Act. And the objectives today are to hopefully help you understand what's changing with Medicare Part D in 2025. There are improvements, and then we'll go over at the end who can enroll and how to. So the Inflation Reduction Act was passed in August 16th, 2022, sorry. It's a federal law that was aimed to reduce the federal government budget, but we're going to focus on how it was aimed to lower the cost of prescription drugs for not just Medicare prescription drug plans, but individual group and standalone plans as well. And the third thing that the focus was on for the IRA was to invest in domestic energy production. There was a 10-year plan to make all of these changes. The changes started in 2023 and they will continue to happen until 2032. And so some of the changes that I mentioned today during the presentation have already happened, but a lot of them are still going to happen. The major changes are happening for 2025 for the Medicare Part D plan. And so what does this act mean for Medicare? When this act was put into place, it was spoken to provide relief for millions by expanding Medicare benefits. And so those benefits included vaccines. Any CDC vaccine that's recommended for people over the age of 65 is now covered by Medicare at 100%. And then it also helped strengthen the Medicare Part D plans by keeping the premiums stable, by negotiating directly with manufacturers to lower price of some of the costliest brand name RXs. And we'll get into that a little bit more in the presentation. It also, the act required drug companies to pay Medicare a rebate when they raise prices for their prescriptions faster than inflation. And I'm sure anyone that's listening has seen that happen with their prescriptions or have heard of it happening with other people's prescriptions. So what is Part D? So Medicare Part D is a federal program that came out, I believe, in 2006. Don't quote me on that, but I'm pretty sure it was 2006. They are private insurance companies. So Medicare Part D, Medicare has created a standard plan to cover the cost of medications for people who are eligible for Medicare. And then there's private insurance companies that offer the standard coverage or better. Most companies offer better coverage than the standard coverage. These private insurance companies have to offer, at the minimum, the standard coverage. Each plan, so each private insurance company can dictate which list of medications they want to cover. However, they must cover every medication, not every medication, every therapeutic category. And so at least one medication will be covered under each therapeutic category. And so each plan differs between formulary, which is a list of drugs that are covered under that plan. And they also differ between preferred pharmacies, and possibly the deductibles and co-payments will be different as well. These formulary lists, they change annually, and they can also change throughout the year. If you are on a medication when the formulary changes, the drug plan is required to send you a letter to let you know what those changes are. People with Medicare will benefit from lower drug costs in 2025. And so that's what we're going to go over next. So in 2023, some insulin, not all, is available at $35 a month. And so this really helped people who were on insulin to control their diabetes. No matter what the phase they were in throughout their Part D prescription plan, the insulin stayed at $35 all year long. So this was really a great benefit that the Inflation Reduction Act put in place. I mentioned it earlier, but access to recommended adult vaccines without cost sharing is also covered under your Part D prescription plan. And then newly in 2025, there's a yearly cap of $2,000 for prescription drug costs that are covered by your Medicare Part D plan. And so what does that mean to you? So that $2,000 maximum, which we'll talk about it a little bit further as well, but that maximum is an out-of-pocket maximum that you pay. And so your co-pays and your percentages that you pay to the pharmacy for your prescriptions go towards this $2,000 maximum. And if you ever meet it, you're covered 100%. And if you already have Medicare Part D and have costly medications or have heard of someone who may have costly medications, you will know this is a big benefit for people, because I have had personally seen people's medications costing them anywhere from $6,000 to $20,000 a year. And that's not affordable. And so this new out-of-pocket maximum is just wonderful for people for 2025. Another thing that has improved for 2025 is the expansion of the low income subsidy program. So there is a subsidy through the federal government called Extra Help or low income subsidy that helps pay for the cost of your Medicare prescription drug plan. The expansion just increased the income on what you would be, or decrease the income on how it makes people eligible. And then newly to, I giggle about this one because I don't know how they're going to maintain it, but new to the 2025 Medicare prescription drug plans is a prescription payment plan. So not only are the prescription plans required to help cover medications, now they're going to have payment plans for your medications if they cost over a certain amount. And so I can go into detail with that a little bit further if you would like. So the prescription payment plan, if your medication costs more than $600, I believe is the amount, then your pharmacy will charge you $0, and then your prescription plan will send you a bill to spread that prescription cost out over the entire year. Now, you do have to enroll in the prescription drug plan. It's not automatic. And so if you wanted to be part of the payment plan, you would contact your Part D prescription plan directly and enroll in it directly. It is a separate bill from your Part D plan, so you would still pay your premium to the Part D plan and have another bill for your prescription plans. And that payment goes to the prescription plan, and then it gets paid back to the pharmacy. It's a whole big circle, but hopefully it'll work. Just to show you the different phases. So Medicare Part D has always had different phases of coverage. And so I describe different phases of coverage is that in each phase, you pay a different amount for your medication. And so in 2025, this is what the phases look like. There's technically only going to be 2 phases because the first phase is your deductible phase. If the plan has a deductible, that deductible cannot be more than $590. So it could be less. Remember that standard that I talked about in the beginning. $590 is the standard Part D deductible. If you have a deductible in your plan, it is also possible that generic prescriptions are waived. Once you've met your deductible of $590, then you go into the initial coverage phase. During that phase, you're either going to pay a copayment, which is a set dollar amount, like $4 or $5 for your medications, or you're going to pay a coinsurance, which is a percentage. That standard coinsurance is 25% that Medicare has set. And so drug plans will either charge you 25% for the cost of your brand name medications or less. You will continue to pay those co-payments, your deductible, and the 25% until your max out of pocket has reached $2,000. Once you've reached the $2,000, your medications are covered 100%. That's what the catastrophic phase is that your medications are covered 100% once you've reached the true out-of-pocket maximum. Everything resets January 1st. So if you are a person turning 65 late in the year, you'll only have a Part D prescription plan for a couple of months. And then everything starts over January 1st every single year. So just to give you an example, I wish I could go back even further. I will tell you just a little bit though. Prior to the Inflation Reduction Act, we had something called a donut hole, the Medicare Part D plans. And if you've ever heard of that, when someone got to that donut hole, they paid 100% of the cost of their medications. And just imagine how expensive that is. And the 100% of the cost of their medications, they had no coverage until they reached another amount, which was like $7,000 or $8,000. And so that really hurt people. So in 2024, the out-of-pocket maximum was $8,000 total. However, they still had the coverage gap, which was also called the donut hole. And so just to show you the differences between 2024 and 2025, how big of a deal this $2,000 maximum is, this is really going to help people in 2025 with their cost of their medications. Now, as you may know, when things and benefits enhance, premiums typically go up, but we are not seeing that for 2025. I believe that is part of the Inflation Reduction Act, where they're going to negotiate prices for medications. The Part D plans are negotiating prices with the manufacturers to help try to keep premiums down. We can't promise that premiums will stay down for each year after, but so far the premiums are still stable. So when can you enroll? Or who can enroll, sorry. So anyone who is covered by Medicare Part A or Part B is eligible to join a Part D prescription plan. And then there's 3 different times you can enroll in a Medicare Part D plan. So if you are already enrolled in a Medicare Part D plan, you can only change your plan during the annual enrollment period, which is coming up. It's October 15th through December 7th. Changes take place January 1st. If you are turning 65, you can enroll in a Medicare Part D plan during your 7-month period. That includes 3 months before your birthday, the month of your birthday, and then 3 months after. And then there's also special enrollment periods. I listed just a few of the common special enrollment periods, which is loss of employer coverage, a disaster, or if you've moved out of your service area. Those are a few reasons on why you can change your plan throughout the year, or why you can gain a plan. So loss of employer coverage would be a reason why you could gain a plan during the year. So how to evaluate your Medicare Part D plan? If you wanted to take it on yourself, you could go through Medicare.gov and evaluate your prescription drug plan on your own, or you can contact a SHIP counselor office, or you can find a local agency or agent like ourselves. We recommend that they're licensed and that they're able to help you evaluate your options and help you enroll. So it's really important to make sure you know what your options are. I think everybody should check their plan options every single year. It's very important because formularies change, and pharmacy lists change. And also your prescriptions change. And so it's very important to make sure that whatever plan you have is still good for the following year. And just because it is good now and it covers your drugs now, it doesn't mean it's going to be the same next year. The plans change from year to year. So it's very important to know your options. And I do want to just speak really quickly about the state of Maryland retirees. The state of Maryland retirees, if there are any on this call, are losing their prescription drug plans as of December 31st, 2024. And so you should have received plenty of mail helping to guide you in the direction you need to go. But I know that mail has probably really piled up and it's a little bit confusing, to say the least. The state of Maryland has hired a outside agency called Via Benefits, and you must use them to enroll in your Medicare Part D plan if you're eligible for the health reimbursement arrangement. And so people who are eligible for the health reimbursement arrangement is stated in one of the FAQ letters that was sent out on May 20th. And so if you were hired by the state of Maryland before June 30th and retired before January 1st, 2020, you are eligible to receive money in the form of like a debit card that will help you pay for the cost of your medication. It will not help you pay for your prescription plan, but it will help you pay for the cost of your medication. Those that are not eligible, regardless of their date of hire, if they retired after January 1st, 2020, they're not eligible for the HRA. You could also use Via Benefits, but you could also try to find a special agent in your area or help yourself through Medicare.gov. If there are people using Via Benefits already on this call, I recommend that you do the research yourself as well on Medicare.gov's website for your medications. There have sometimes been discrepancies between what is shown on Medicare.gov versus some of the sites that have been created to help people shop for their prescription drug plans. Hold on one sec. And so just to let you know that all of the services here at Avery Hall, these are all of the services that we provide. I mentioned earlier that we try to do all things insurance. So this isn't all, this is probably just a few of them. However, our services are free. That's the main point of this slide, is to let you know that when you do use an agent or a broker, our services are completely free. And if you do have questions, you can contact any of us by using Medicare@averyhall.com, and we'll be happy to help you answer any questions you have or with your Medicare or anything else insurance related.
Thanks, Alyssa. At this time, if you guys have any questions, if you could post them in the chat, I'd be happy to ask Alyssa while we have her and take advantage of her expertise. I will say now more than ever, and I'm sure Alyssa would agree with me on that, while you said, Alyssa, that they should always run their, check their plans, right? Make sure that their plan is going to continue on the way it has been each year. This year, more than ever, I would say it was probably really important because these plans could be changing, and by entering your prescriptions into Medicare.gov and working with a professional like Alyssa will help make sure that you are in the right plan for you. Yes, absolutely. Yeah. Yeah. I don't see any questions. This is a recorded webinar. We will be sharing on our website. So, but you can always reach out to Alyssa or myself if you have follow-up questions as you go through the process of making sure your plan is the right plan for you for next year. With that, I guess that's it. All righty then. Thank you guys so much for having me today, and have a great day. Thanks, Alyssa. Take care.